You want to check with articulating paper. It's got blue on one side and red on the other side, so you alternate it every time you use it. So this is a U-shaped articulating paper which you want to place it all across the arch and ask the patient to close slowly. Open. Open. It has contact. First contact you take off. Just touch. Okay. Just touch. Okay. Open. Because I don't know if the denture has been checked for interferences, so I just want to see if there is any interference. When I see it like this, I see one cusp contact here and one contact on this one. Okay. Now this one may be reducible because of non-functional cusp. I just want to check where is this touching really. So put them both together. Go to the back, and from the back you can see that this cusp is getting touched here, and I think this is acrylic because the acrylic seems to have flowed over into this. Can you see it? No? Stay out. Stay out. Is there anything in the background that is interfering? Just turn it around. Flip over. Just flip it over. Flip it over. Screen. Okay. Yes. Okay. Here you can see that this spot possibly is coming because there seems to be some acrylic. I told you before, some pink acrylic seems to have flowed over it, and there's an extension of that into this. So you want to possibly reduce this out. And this is possibly one of the first places that are contacting. You want to take it off because you don't want it to interfere in the occlusion. That should be fine. Recheck again in the mouth. Now this time you want to wipe it clean. Place it back in the mouth. Posterior, down, and then seated. Any pain? No. No. The upper. And then this time, last time we placed the blue on top and the red down. We're going to do it the other way. We're going to place blue down and red on top so that we know which is a new mark. Open, open, open. Make sure the posteriors are straight. Goes in. Okay, fine. Okay, I want you to bite in centric. Yeah, just bite like that. Relax, relax, relax your mouth. Just that's one movement. Halisaka show you gobi. Bit tight. Okay, open. You want to see if there's any high points. You see it like this. Same story. You can see that there is a mark here. Okay. You see this mark here where the white is eroded in the center and there's a red in the side. This kind of marks are usually high points, okay? And you want to just slightly reduce that off. If you check, it is coming off from this cusp here, from this cusp. Since this is a functional cusp, you possibly want to reduce this. Since this is a functional cusp, you possibly want to reduce this one because this is on a non-functional cusp. So I'm going to take it off with a straight hand piece and then go back into the patient's mouth. Okay, so you want to go back with this into the mouth, posterior down, placed, upper, rotate into the mouth, place correctly, bite. Okay. Now you want to check for the occlusion on both sides. So you want to retract with the mouth mirror and you want to see the occlusion here. So you see the interdigitation here in all of this. You want to use a probe, go in between and try to separate them. You can see that you can't separate them. That means the bases are contacting on both sides correctly. You also want to check the same thing on this side. So you come here and here again put your probe in between and see, when you put the probe in between, there seems to be some spacing, some minor spacing, possibly out of a high contact in the posterior, because this seems to be not moving. Here there seems to be some movement. So let's see. Check with an arterial paper again. Down this time. Okay, relax. No, just relax. Open. Right. Open. Right. Open. Open. Right. Okay, do this. Okay, go we. Okay. Open. Open. Both sides equal or you feel loose on one side? Both sides are equal or you feel loose on one side? Equal?